It has to do with what you just summarized, which is that women tend to act as the emotional shock absorbers. The man will act out his suffering through substance use or through violence. Men are acculturated is to act out their stresses, whereas women act them in.
There's unique pressures on women in society, but there's also unique toxic pressures on men. What do you see as the key difference between what we're being asked to do? And is it biological or is it cultural?
Well, deep question. Statistically, women are much more likely to be diagnosed with PTSD, double with anxiety and depression. They tend to take, they're the ones who tend to take psychiatric medications much more often than men do, statistically. And I don't think that has to do with any biological determinant. It has to do with what you just summarized, which is that women tend to act as the emotional shock absorbers. So very often, there's a fascinating study out of Sweden. They looked at premature birth. If a woman had depression during pregnancy, I think in the first trimester or the second, that increased their chance of premature birth, late premature birth, so 32 weeks or afterwards. But if the father had depression, that increased the chance of even earlier premature birth.
Wow.
Now, how do we explain that? Because the woman absorbs the stresses of the husband. So, and that affects her physiology. So the reason women are more likely to be diagnosed, quite apart from the fact that being a woman in society, being a female child, really exposes you to trauma. Not that being a male protects you from it, but sexual abuse, which happens to men as well, young boys as well, as we know, is more likely to happen to a young girl. And so trauma, that particular form of trauma, which is a significant risk factor for mental health conditions, depression, substance abuse, anxiety, and so on, happens to young girls more. So, and then there's the general role of women as shock absorbers. Now, men also suffer, just as you say, but the way that men are acculturated is to act out their stresses, whereas women act them in. So that in the women, it happens to be more internal. The man will act out his suffering through substance use or through violence, through dominating a woman, through finding a woman to absorb his stresses. You know, there's this toxic masculinity. When you talk to men with PTSD, soldiers who've been in battle and come back with severe symptoms, one of the things that inhibit their healing is the expectation that they should be tough and suck it up and not talk about their vulnerability. So that the expectation on men not to be vulnerable is a huge source of pressure and dysfunction for men. And when they heal, these tough veterans who've had their friends killed, who they themselves may have been injured, who've killed others, they soften up. They start finding their tears. They start finding their vulnerability that they've had to suppress all their lives. So that's how it works with men. Yeah. And, Harry and I did talk about vulnerability. Vulnerability comes from the Latin word vulnerare, to wound. And human beings are profoundly vulnerable from conception until death. We're all vulnerable. We can all be wounded. But in our society, men are expected to stifle and hide and reject their vulnerability. Don't be a sissy. We associate vulnerability with feminine qualities that we're supposed to disdain. Yeah. And that's a big pressure on men.